If you're experiencing pain on the outside of your hip and you've also tried the Pilates clam exercise and haven't got on very well with that one, then follow this Pilates routine and it should help to reduce your lateral hip pain. There's 4 levels to this, and then we'll do a stretch at the end. For part 1, you want a belt over your knees so that you can push out against the belt and get your glutes to contract. We're going to do 6 repetitions of each. So push out against the belt. No movement will occur because the belt is stopping your legs from pulling apart, but push out against the belt and sustain that outward push for 5 seconds. And then relax for 5 seconds and repeat again for 5 seconds. So we're going to do 6 repetitions. We've done 2. Relax. And again, push out. 5, 4, 3, 2, 1. And relax. Let's do 2 more pushes. Pushing out, sustain that for 5 seconds. And relax. 1 more. Push out. Sustain that. And relax. Okay, that's level 1. We're going to move on to level 2 now. Push out against the belt again, but only with about 20 to 30% effort, so that the muscles in your glutes here are switched on and there's tension in the belt, but you're not pushing as hard as you were in level 1. Then tighten up your lower abdominals, tighten up your glutes and get your pelvis to tilt up towards you. So you tuck your bum in, tummy tightens up, pelvis starts to lift off the ground. Continue that movement so that you start to roll off the floor until you end up in this bridge position with your thighs in line with your spine. Hold that position and then slowly roll back down, starting with the spine and finishing with the pelvis. That's number 1. We'll go again for number 2. Lifting into the bridge position and rolling back down. Try to imagine you're peeling your spine off the floor or lifting it 1 vertebrae at a time up and then placing it back down 1 vertebrae at a time. Brilliant. Let's keep going. Lifting up, hold, and down. Okay, 3 more. Keep your breathing steady with this one. There's no need to hold your breath at any point with these exercises. If any of these exercises cause you pain and the pain and discomfort is made worse or worsens during the exercises, then of course stop doing them and make sure you consult a medical professional. Now we're going to move on to phase 3. Come up into the bridge position and hold, and then relax one of your glutes so that the hip drops down but the other one stays up. Bring that hip back up again by contracting the glutes, then let the opposite side drop down and lift up. Don't worry too much about pushing out into the belt with this one, just focus on the drop down. So bridge position, drop down and up. Left side drops down and back up. Right side drops down and back up. So if we're doing 6 repetitions, we might actually do 12 so that we then do 6 on each side. So after 12 repetitions, roll back down. Okay, are you ready for level 4? Have a look, and if you can do this one, follow along with me. If not, don't worry, just stick to the levels 1, 2 and 3. Start by rolling up into the bridge position. From that position, unweight one of your feet and straighten your knee so that it's in line with the other leg. And down. Switch to the other side and down. So we're going to go for 12 so that we have 6 on each side. Make sure you keep your hips up and don't let them drop down as you're doing this exercise. you're breathing steady. And roll back down. So to finish off, lie on your back, pull your knee into your chest and feel your glutes stretching. Do both sides and hold each one for at least 5 to 10 seconds. So I hope you got on okay with those. Let me know in the comments which one you found the most useful and if you found some of them a bit too challenging. If you found the video helpful, please give it a like and share it with anybody who you know who may find it helpful. Thanks for watching the Physio channel. We'll see you in the next video.